I think I belong to a family of doctors. And at that time, when I wanted to be a doctor, I was sure. But a dentist, I think it just sort of, I've realized that, things have cosmically chosen me. Okay, I really enjoyed looking at people smile, and aesthetics mean a lot to me. So I think it's a medical field which is related with aesthetics. And I think that is what drew me in. And then the more I got into it, I realized that, it's a mix of artistry, engineering, and biology, and all of that. It just integrates so many things together. When you're doing aesthetic dentistry, you do follow the golden proportion, Da Vinci's golden proportion, to create symmetry, and which is like beauty to the eye. Hypnotherapy can really help you regulate your emotions, anything that's being felt in excess, loss of a loved one, grief, uh, or like a personal loss in any way can be dealt with through hypnotherapy, emotional regulation techniques. I paint acrylic on canvas, and I do a bit of mixed media. And I think it's very absorbing, very therapeutic. It's the therapist therapy. And I always tell my patients that, I'm a better doctor, I'm a better dentist, and a better therapist if I have painted that day.
Greetings, friends. Welcome to another exciting episode of Vision and Voices, to which I warmly welcome our very accomplished and delightful guest, Dr. Richa Dhamija, a true healer in every sense. Our conversation today with her is on issues ranging from dental health to mental well being. Richa is a dental surgeon, implantologist, dental hypnotherapist, founder of the House of Smiles for Dentistry, and founder of Hope Nest, a hypnotherapy platform for healing and coaching. She has around, believe it or not, 30 years of experience as a senior dental surgeon. She has virtually redefined dentistry by integrating neuroscience, hypnotherapy, and emotional regulation into overall clinical care. She's also an established artist, a painter, and now a budding sculptor. So, having started as a resident at the famous All India Institute of Medical Sciences and LNJP Hospital, she went on to working as a clinical assistant at Addenbrooke's University Hospital, Cambridge, UK. Later, she was the associate editor at Dental Practice, an internationally indexed journal, very, very well known journal. She is, of course, Richa is a registered hypnotherapist at GHSC, United Kingdom. So, combining her prowess in dentistry with interest in hypnotherapy, she has bridged, this clinical dentistry with nervous system science. She has she has even trained dentists through the Indian Academy of Dental Hypnosis, and of course, from there on, logically so, she has established the practice of healing through her Hope Nest platform, which encourages integration of psychology with medical practice generally. The impact, of course, friends, you might know that the impact of oral health on general well being is wide ranging, but what you perhaps some of you may not know, that it even impacts cardiac health and cardiac health issues and various other vital functions of the body. Nevertheless, in countries like ours, on the one hand, on the one side, there is a huge deficit of basic dental health care and understanding of dental hygiene for the common man. And on the other side, we have people with loads of money ready to spend for exorbitant interventions to get a better smile on their face. So that is the level of disparity. And logically, in the words of Dr. Terry Alani, the greatest thing you can do for yourself, Richa, you might agree with me later there, is to take care of your mouth
Hmm.
because it affects everything
Hmm.
else you
Hmm.
might do. Dr. Richa, you have traversed a long journey turning your aspirations into your achievements. What inspired you to become a dentist?
I think I belong to a family of doctors. And at that time, when I wanted to be a doctor, I was sure. But a dentist, I think it just sort of, I've realized that, things have cosmically chosen me. So, I initially chose dentistry because I was just, I really enjoyed looking at people smile, and aesthetics mean a lot to me. So I think it's a medical field which is related with aesthetics. And I think that is what uh, drew me in. And then the more I got into it, I realized that, it's a mix of artistry, engineering, and biology, and all of that. It just integrates so many things together. And it was really, then of course, like once you're on the learning high, it's a learning high. And then I've learned, I did facial reconstruction when I was working in Cambridge. It's like when people met with a roadside trauma, and they broke teeth and facial fracture and plastic. So it was very fascinating to work with the plastics team to bring the whole face together and the smile together. So
Very interesting.
yeah, so it's like, and there is beauty in it when you put things back together aesthetically. And when you're doing aesthetic dentistry, you do follow the golden proportion, Da Vinci's golden proportion, to create symmetry, and which is like beauty to the eye.
How
So I think
nice.
that is how dentistry happened. The
Okay.
love for aesthetics.
That explains a lot
Hmm.
about you, as a matter of
Hmm.
fact.
Hmm.
And I will come to that aspect little down the line.
Hmm.
But before that, would it be appropriate to call you an entrepreneur as
Hmm.
well, given your sense of enterprise in establishing that beautiful house of smiles as also your platform, Hope Nest?
You could call me that, but that was never the set intent, really. And I think I'm more purely driven by passion and whatever skills are required to execute that passion. For example, if I wanted good smiles, healthy mouth, and do dentistry. So I think whatever skills were required, we're not really taught management. And when we're studying science and becoming doctors, it's very academic. And I think that was a challenge when I started out work. There were so many management skills, but then you acquire it on the job, and to make a system run smoothly. So, and then I think it's again with hypnotherapy. I think when I realized what it can do for people, whatever was required to do around it, whether it was even a digital presence and all that, it didn't come naturally to me, but then I acquired those skills on the job.
I
Because once a
see.
passion is there, everything falls in place.
Wonderful. Yes,
Mhm. So
you're
I never
right.
thought of myself as an entrepreneur, but yeah, you do need these skills to execute and make the show going. Yeah.
You obviously need passion and you need a sense of, to be a healer,
Hmm.
you definitely need passion.
Hmm.
And to be an entrepreneur too,
Hmm.
you need passion.
Hmm.
So it doesn't work otherwise.
Hmm.
I can clearly see that you have a very high
Hmm.
empathy quotient
Hmm. Hmm.
that has taken you into the direction of comforting your patients through hypnotherapy and maybe later continuing that journey towards general healing and
Hmm.
mental health.
Hmm.
You have touched upon this in your last answer, but I would like you to further elaborate on this. What is it that pulls, what is it that makes you have so much of faith in hypnotherapy and, managing pain and agony of people from that
So
platform?
originally, I think what happened was that you're dealing with people all the time, and like you said, the empathy quotient is high. I think that's always a gift. And I was generally kind. I always would let, I would do small things, like if I was just going to lean back the patient, I will just tell them that I'm just going to lean you back. Small things, so like in terms of gestures and stuff, it was always there. But to take it one step further, when I saw people were very anxious, and I could see, and they knew consciously with the conscious mind that they do need the care, but the fear and the trigger and the anxiety is so high that it'll hamper them to get the treatment done. And so as a result, they will see themselves deteriorate orally. And I think I knew about hypnotherapy when I was in UK only. I was much younger. I was my early 20s when I got to know about hypnotherapy. But then when I was doing my own clinical practice, I realized the need. And that is how it led to learning hypnotherapy for anxiety, for OCD, for fear, phobias, byte code fear. there is needle phobia and things like that. Then it just I started learning hypnotherapy for dentistry. And then while I was studying hypnotherapy, I realized that, you can use it for hypnobirthing. And when it can assist birthing, which is like such a painful process for a woman. And so hypnotherapy is very wonderful for psychosomatic pain. When, for example, there's always a component of, for example, a person has a diabetic foot and the amputation of the foot is required. So the physical rehab is done, the surgically, the procedure is done, but the person himself is dealing with a loss of limb. So there's a huge emotional factor attached to that as well, and that is not a part of mainstream rehab. The emotional counseling of a patient who's just lost a foot. So that's where hypnotherapy comes in, where you deal with the emotional aspect of things. And so, for example, I twisted my ankle once, and there was a ligament tear. Now, the ligament tear itself is a physical issue, but there's so much around it that how will I drive? How will I work out? I will gain weight. It'll incapacitate me. It's giving me asymmetry. There's so much going around a physical issue. So there's always an emotional suffering component. For example, a person who's just diagnosed with cancer. It's such a blow. I mean, you get on with it, you process your emotions, and then you get on with the treatment. But there's always a huge emotional cloud which is going on of the suffering that you can. So, hypnotherapy can really help you regulate your emotions, anything that's being felt in excess, loss of a loved one, grief, or like a personal loss in any way can be dealt with through hypnotherapy, emotional regulation techniques. So though I started with dental anxiety issues, I learned for that. And then I kept on learning that you can apply it for so many things. Then it became my dream that, I want more and more doctors enrolled in the role of this, so they can offer as a adjunct to whatever they're executing.
Rarely do we come across people with an endowed connection between the left and right hemisphere of the brain, the logical and the creative. Friends, Dr. Richa is indeed one such entity. Aside from her medical and entrepreneurial acumen, she's also a fairly recognized painter and now a budding sculptor, as I have mentioned earlier. And I would like to ask her a little more about her artistic pursuits before I come back again to dentistry.
And that's easy to talk about because that's like pure passion. And so I paint acrylic on canvas, and I do a bit of mixed media. And I think it's very absorbing, very therapeutic. It's the therapist therapy. And I always tell my patients that, I'm a better doctor, I'm a better dentist and a better therapist if I have painted that day. Because it's so meditative, it's so calming that, when I'm painting, it's like, I could paint it 6 to 8 hours at a stretch and not look at my phone, not be hungry and things like that. So, and it just kept on. I started painting for the love of painting. And then I was lucky with friends, artist friends, that I got invited to exhibit and stuff. And it was, of course, jittery to put your stuff out there because I thought I was just painting at home. But then I was received very well, and I'm very happy with that. I think it's a childhood dream that came true. I was really good at painting when I was young. And I think I always wanted to paint, but I realized it now, and I'm very happy about it.
Wonderful. And this thing about sculpture, because after all, your line of work has a lot to do with sculpting as well. So, virtually sculpting the mouth and all of that. So, what about sculpture? I believe you're getting into sculpture as well.
I think more sculpting happens in the mouth in more challenging environments, but I just dabble with wax and stuff like that. I mean, I think I'm just beginning to dabble.
Okay.
So it's just another medium to express.
In what category can we put your form of art? Like there's abstract, there's modern, there's all kinds of art. Now, what is the kind of category that you paint in?
So, I've not really figured out my categories yet. And, it's like all about coming out of boxes. And I think I've come out of many boxes, and I think I'm always still coming out of many boxes and dropping all sorts of judgment, limitations about others, beliefs and things like that. And so painting, I started out with, I was very inspired by Binoy Behl's Ajanta Ellora work. So my first paintings were very Indian, and I dedicated an entire collection to that. And then I went on to do, I did a series of musicians. So, I mean, it's like people, and I wanted to my painting not to be static. I wanted to capture movement in my painting. So, like an act is happening. So, like a person is playing a flute, or a person is dancing, things like that. And now I think I've moved on to more, moving towards more abstract, like a mixture of some details and some abstract. And I think my theme is fantasy. So now I'm painting fantasy. Like I have a very beautiful painting. It's a mermaid sitting on an octopus at the bottom of the sea.
A
A
mermaid
mermaid sitting. So it's like fantasy
sitting
theme
on an octopus
in the bottom of the
in the
sea.
bottom of the sea. Now
See, yeah. So yeah.
that is imagination at its.
So when I say fantasy and abstract, it's like you're literally coming out of a box and there is no category. So like I said, if I'm painting fantasy, then there is literally no category.
Wonderful.
So I'm having fun with it. Really, that's it.
Amazing. And I can clearly see that your connect with your universe is very intense. What with your indulgence in arts and painting and all of that, hypnotherapy, which is why perhaps, which is what explains your success in all your ventures. Now, on a more mundane note, I see these dental hot shops coming up everywhere, in little small places, even in rural areas. There's a dental clinic everywhere. It's almost like a shop. So many of them. They're sprouting. Now, what exactly is this indicative of a demand and supply situation here? And talking about dental services in our country, how accessible are they and affordable? And even more than that, how hygiene and safe are they? This is my.
So I'll come to the hygiene and safe part a little later. So according to WHO, 1:4,000 is the ratio of one dentist for people, which is really good for a developing country. But the service availability is a bit skewed. So we are in cities and so suburbs and cities, it's pretty high. The availability is pretty high. As we move to rural areas, it's very low actually. So the number of dentists is fairly adequate. But so as it's more, we are saturated in the cities, unfortunately. 70 to 80% is in two tier and main cities and stuff like that. But as you move to three tiers, so the quality of dentistry, unfortunately, see, it's very, because we're dealing with blood and saliva. And if the cross infection is not taken care of, it can lead to HIV, hepatitis, and spread of disease and things like that. So I mean, I'm sure it's not being managed at a smaller setup maybe that well. And so one is despite the gap, there's a distinct gap. So where the patients are more, the doctors are less, and where the patients are less, the doctors are more in the cities. So, so there are many, of course, all level of strata of people need care. So I would say that I'm sure they're catering to people. So all strata is taken care of, at least in the cities.
Okay. Now, the next thing that again, to do with your pursuits, mental health, and mental well-being, and all of that. I was recently reading a piece on mental health of young Indians, and I was alarmed by the statistics I saw, which virtually translate into the fact that it's almost very rarely that we would have a perfectly sane and mentally balanced person who we are dealing with. I mean, the incidence is almost that bad. So, is this a global trend? Is just happening in India? And how is it going to be addressed? How are we addressing it?
So mental health, I think the focus is just coming in our country just now. And all across the world, there is a lot of focus already. What we know is that, because the mental health facilities are not so maybe accessible or affordable and things like that. Stratas, I would say many communities, it can also almost criminalize, the illness can be criminalized. So a person who needs clinical care would end up in the legal system, being punished for some things and things like that. But all they need is the correct mental health care. And Mental health can impact the economy of a country because what happens is a low happy quotient, like India, mein happy quotient is really low actually, and so that will reduce productivity, reduced efficiency. You're at work, you're really present. It's called presentism. So you're present at work, but not really productive, and absenteeism. So also mental health, if it's not good, it will eventually lead to physical issues like cardiac health. A person who's of low happy quotient will do low self care, will make the wrong food choices, will not go and get help in time and things like that. So there is a profound connection between mental and physical health, and mental health impacts physical health as well. Uh, Mental health is critical for parents as well because they're raising young children and shaping young minds. Mental health is important for the teachers who are teaching as well because they are again shaping young minds. And so older people have different kind of mental well-being issues, like they are prone to depression and isolation and things like that. So mental health is a very wide and a very multifaceted and a very complex issue. And I'm very fortunate. Dr. Shelja is initiating a mental well-being a pilot project to address this and take it to she has a plan. I mean, she has a vision that we can take it to all stratas, and I'm working on it with her, and I'm very happy about it, very excited about that.
Wonderful. You
So
are associated with
we'll be
her.
doing something very a simple tool called emotional freedom technique, which everybody can use themselves. It's just by tapping at certain points on the body, you can regulate the emotions very easily in very little time.
Oh, really?
Yeah. So all the excess, overwhelming emotions, anxiety, and things can so that's where and they're doing in a very they're bringing neuroscience properly to study to study the measurable effect of it. So
Wonderful.
tangible, measurable effect of the tools that we're going to use and teach. So I'm
Wonderful.
really looking forward to that.
This is very, very, very pertinent, and I think it's the need of the day. Because balance of the mind of individuals and higher levels of general satiety, make for a more peaceful commune and society, and thereafter the nation. So obviously, when we talk about mental health issues, we are looking at the aggregate, mood of the country itself. You know, so mental health is if mental health suffers, for example, criminality is one manifestation, or misunderstood criminality is what you were
Absolutely,
possibly referring
absolutely.
to. The other manifestation could also be things like hyper religion,
Hmm.
overindulgence and
Hmm.
hyper ideologies and all of that.
Hmm.
So these are matters of great interest, I'm sure, and your endeavor would do great justice as one of the possibly many millions of endeavors
Hmm.
of that kind that should be
Hmm.
there
Yeah,
in
absolutely.
this space, so to say. So now, is your hopeness by itself looking at functional aspects of mental health and its societal impact?
So we are doing that one-on-one therapy that I do. Besides that, the workshops that I'm doing for doctors, and and then I'm doing the hopefully that the reach is going to be much wider now.
Best
So I'm
wishes
really
for
looking
that.
forward to that. That to see, and we'll be able to study the impact as well.
Very
So
important.
first we'll do it out there. We are still in very initial stages. Once we'll do it out there, and then hopefully we'll get to see what change it's bringing. So we'll get to know, try to measure it as well.
Oh.
So then I will know better what sort of impact it's going to generate.
No, that would be very logical. I think that's the only way to do it. Really wish you very well for that. But now to conclude, can you please recount some turning points in your life and people who've played a key role in inspiring you? Should you wish? It's
I
an
would love
optional
to.
question.
I would love to, yeah. So I think one aspect is that, I'm very inspired by the patients themselves. It's the need that they have. And when I see a window where I can do something, that's very inspiring. Because, when you see people for dental appointments, you get to meet them again and again. So not only you just get to know the local dental part of things, but their entire personality and things like that, their minor quirks and nuances and things. And so when I started acquiring hypnotherapy and how I was able to adapt and things like that, so it's the need of the people that helps you train yourself, go like, study more, train more. Just working with people is inspiring, one to one. That is very inspiring. So I would owe that to them as well. And also, I think I've been very fortunate with teachers, and I've been so there is in my dental field there is Dr. Shankar Iyer, and he teaches for American Academy of Implant Dentistry. So this person is like Shah Rukh Khan of dentistry, huh? Very versatile. So there's 7 specialties within dentistry, but when he's teaching, he just blends all the specialties so seamlessly together to just bring it in a manner that, like, you can actually take it away. He's really moving and inspiring, touching, moving, and inspiring the dentist to do better, to excel, like, take them to the next level of excellence. So he's one of those people that once I attended his lectures, I just decided to practice, take my practice to the next level. So he was my dental inspiration. And hypnotherapy, also many teachers. There is Urmi Dutt, there is Neerja Handa, there is Dr. Yuvraj Kapadia in India, there's Mr. Mark in UK where I studied from. So, it's like I've just been really lucky, and I was very inspired by them, their work, because they've been putting in years and years, and then they're sharing knowledge so generously. So I aim to do the same.
And so, anyway, so people such as you, I can clearly see they bring a lot of joy into the lives of those they interface. I've been seeing it. We know as the little that I know about you. Dentistry, on the other hand, is a vital medical service, and smiles on the other hand, yet still are connotative of good health and general happiness. So, on a concluding note, for your avocation, for your commitment, I want to cite Og Mandino, who you might know about, who said that a smile remains the most inexpensive gift you can bestow on anyone, and yet it is powerful enough to vanquish kingdoms. So that is the power of a smile that Dr. Richa, you put on the faces of people. Now, with this,
thank you for very kind words.
Thank you very much for this enlightening conversation, and good luck for your future endeavors.
Very delightful for me indeed too.
God bless. Thank you.
Thank you.
Thank you, viewers.